So plantar fasciitis, what is it and how can we help with it? Okay, so plantar fasciitis seems to be one of those conditions that people have heard of but don't really know much about until you get it, that is. Then you know all about it because it's really painful, or it can be really painful. Okay, so plantar fasciitis is pain that you experience in your heel of your foot and also into the arch of your foot. So if this is your foot, it's not, again, it's my hand, but yeah, that's the heel, and then you get the arch of the foot, okay? So the arch of the foot, the inside arch generally. So in the heel, you tend to get pain right into the heel of the foot and then right into the arch and through the arch. And it can be quite a burning and quite a nasty pain, and it tends to be related to weight bearing. So when you're running, walking, you tend to get this pain. It can just go on and on and on without treatment. It can last for quite a long time. Risk factors for this condition, so causes, risk factors, tend to be those who are more obese tend to suffer from this more. Other risk factors are things like those who spend a lot of time on their feet, those who have had a change in activity or footwear. So example, some people who might be wearing, just changed to a more sturdy work boot, for example, the sole of which is not particularly able to take the bend and flexion in the arch of the foot, and that can irritate the foot. Yeah, the foot likes to bend and arch and use the spring effect in the foot, and if that's restricted by quite a stiff work boot, we tend to get people in when they've had that sort of problem. Equally, like I said, people that spend a lot of time on their feet can get this condition, but equally, if you used to have a job where you were on your feet quite a lot, so your foot got used to that, and then maybe you went running a couple of times a week, but now you've started to spend all day at a desk, yeah, your job's changed, and then you're not getting that loading through the foot, and then but you're still going out running in the evenings, because you're not getting the loading during the day, you might start to get irritation because your body's trying to struggle with this sedentary day, coupled with a massive increase in activity in the evening. So there's all sorts of ways. It can either be overactivity, underactivity, and that's all part of the diagnosis from us, and the management and the causation, etc. That we try and investigate exactly what is going on and how this is built up. But in terms of how we treat it, shockwave is proving to be a very effective treatment for it. There's a high degree of efficacy, which is effectiveness, clinically proven effectiveness for the treatment of plantar fasciitis with shockwave, which is why we got the machine in the first place, because it's very good at treating these sorts of conditions. And what shockwave does is it goes in to the insertion point of the plantar fascia, which is effectively a tendon. And what it does is it basically stirs things up, creates a semi-inflammatory process, which then starts to heal the tissue and heal it in a stronger fashion. So it lays down stronger tissue. That, coupled with exercise therapy that we give to all of our patients who have shockwave therapy, can give a really good solution to this sort of thing. So if you are suffering with pain, like I said, in the heel and into the bottom of your foot, that's possibly going to be plantar fasciitis. So let us know, and we can see what we can do to help.